Have you ever had that moment where you stop and think, something about my brain just doesn't feel the same anymore? Not dramatic, not catastrophic, just off. Maybe your memory isn't as sharp or your focus feels a little off. And alongside that, there may be anxiety that wasn't there before, or a heaviness, or a low grade sadness that's just hard to put into words. If that's you, I want to start by saying you are not alone and you're not imagining this. Hi, I'm Dr. Cindy Libert. I'm a family physician with advanced training in functional medicine, brain health, mental health, and I'm also a deeply committed follower of Jesus. And today, I want to talk to you about the real connection between anxiety, depression, and cognitive changes. Not as in a simplistic way, not in a fear based way, but in a way that honors how complex and beautiful and integrated the human person truly is. Here's something I've learned after decades of caring for patients. We were never meant to be fragmented. Our medical system has done extraordinary things, but it tends to separate what was designed to work together: mind and body, symptoms and causes. And when we lose that integration, people often feel unseen and unheard. We were designed as whole beings: body, mind, soul, spirit, woven together in a way that's far more intricate than we often appreciate. And my years in medicine have only deepened that conviction. The brain and the body are not working independently, they respond to one another, and they respond to the environment we live in. When one system of the body is under strain, the other systems feel it. And when we take time to look at the whole person with care and humility, we often begin to understand what the body has been trying to say all along. One of the greatest misunderstandings in modern medicine is that the symptoms are the enemy. We're taught to suppress them and quiet them and override them, sweep them under the drug. But the body doesn't work that way. Symptoms are communication, they're feedback. They're the body's way of saying something needs attention here. And this is very much the case with anxiety, depression, and cognitive decline. These, of course, are not moral failures, they're not character flaws, and they certainly aren't signs of weak faith. Very often, they're signals. In medicine, we've created artificial boundaries that don't exist in real life. We talk about mental health as if it lives in one silo, and brain health as if it lives in another. We separate psychiatry from neurology, psychology from our physiology, and often spirituality from all of it. But the brain doesn't recognize these divisions. The same brain tissue that regulates mood, fear, emotional resilience is the same tissue that's responsible for our memory, focus, word finding, planning, and executive function. So when anxiety and depression show up alongside cognitive changes, the question isn't which one came first. The more useful question is, what's happening underneath that could be affecting all of this at once? This is where functional medicine truly changed everything for me as a physician. Not because I abandon conventional medicine or care, I still use that every day, but functional medicine has taught me to see more clearly, to ask better questions. We know conventional medicine is invaluable, especially when it comes to diagnosing diseases, treating acute illness, and of course, saving lives. I still rely on it. But functional medicine has invited me to ask different kinds of questions. Instead of stopping at what what do we call this that the patient has? What's the label? We ask, why is this happening to this person at this time with their unique story? I've shifted from simply managing symptoms to really digging in and trying to understand root causes. So it's moved me away from that one size fits all sort of algorithmic medicine. So when we take time to ask these deeper questions, something really beautiful happens. Patients feel heard and seen, and patterns start to emerge with sleep and stress and nutrient deficiencies and hormones and traumas that just intersect in the body. Then we can often see where perhaps what we thought were random symptoms are actually part of a pattern from some of these underlying root causes. So I want to walk you through some of the most common biological root causes that I see contributing to anxiety, depression, cognitive decline, and even neurodegenerative diseases like Alzheimer's disease and other forms of dementia. My goal here isn't for you to label yourself, but to help you understand the biological categories that often drive these symptoms and diseases. One major category is inflammation, particularly neuroinflammation. The brain is exquisitely sensitive to inflammatory signals. So, chronic low grade inflammation can alter neurotransmitter function, impair neuroplasticity, and even disrupt the blood brain barrier. All of these processes can interfere with memory and our mood regulation. Of course, inflammation can come from many sources: poor sleep, chronic stress, insulin resistance, autoimmunity, infections, gut permeability, and even environmental exposures. Closely related to our inflammatory response is our infectious burdens. We know that certain infections are, you know, well known to affect the central nervous system. Things like tick-borne illnesses and Lyme disease can cause profound cognitive and psychiatric symptoms, sometimes years after the initial exposure. Also, viral infections, including herpes viruses and others, can remain latent in the nervous system and contribute to neuroinflammation. These are often missed because standard testing is limited and symptoms can be nonspecific. So patients are often told that it's just anxiety or just depression without anyone asking whether or not there might be an infectious driver underlying the symptoms. Another major category is our toxic load. We live in a world that's saturated with environmental chemicals, mold, and mycotoxins from water damaged buildings. These are, very underrecognized but are huge contributors to brain-based symptoms. Mycotoxins can directly impair mitochondrial function, they can disrupt our neurotransmitter balance, activate the immune system, and cause anxiety and brain fog and memory problems and mood changes. So I see this frequently in patients who suddenly decline cognitively or emotionally after a move, a renovation, or a water leak. Environmental chemicals are another category. Things like pesticides, solvents, plastics, heavy metals, and air pollutants also play a role. These compounds are what we call lipophilic, meaning they accumulate in fatty tissues, including the brain. Over time, they can interfere with our detoxification pathways and hormone signalings and just neural communication in general. Again, this doesn't mean everyone with anxiety or depression has a toxin problem, but it means toxins belong in the conversation when symptoms, just don't make sense or people aren't responding to standard treatments. Another critical root cause category is metabolic dysfunction, including insulin resistance and glycotoxicity. The brain is one of the most metabolically active organs in the body. It needs a steady, reliable supply of energy. So when blood sugar is unstable or insulin signaling is impaired, the brain suffers. This can show up as anxiety, irritability, poor concentration, memory lapses, and eventually cognitive decline. We now understand that Alzheimer's disease has such strong metabolic components that some researchers actually are referring to it as type 3 diabetes. So, addressing metabolic health is not optional for brain health. Hormonal and trophic or growth factors also matter very deeply. Sex hormones, thyroid hormone, cortisol, rhythms, and growth factors like brain-derived neurotrophic factor influence our brain's structure and function. When we have declining estrogen, testosterone, dysregulated cortisol, and lack of growth hormone support, this can impair our memory, our resilience, and these often changes happen during midlife when you can experience anxiety, depression, cognitive changes during the perimenopause and menopause timeframe, and andropause in men. And many people are told that it's just aging when there's a hormone component to it. Another important category is our vascular health, and so many things affect that from high blood pressure, high cholesterol, smoking, being sedentary. All of this affects our blood flow to the brain because the tiny little blood vessels, the lining gets damaged by all of these factors and these changes can happen decades before the cognitive decline changes happen. So, to wrap up our root cause analysis of brain-based changes, we can't forget trauma, both physical trauma and psychological trauma. Even mild concussions can play a role in cognitive decline and mood changes. And of course, emotional, psychological trauma can get the body in a state of hypervigilance that affects our nervous system in a profound way. So I want to be clear that we can name all these categories, we can even address many of these root causes through our lifestyle, through targeted nutrition, movement, sleep restoration, regulating our stress response, being in community, even taking medications or supplements. But only God sees the full picture. Only He knows all the layers of these root causes, and of course, only God ultimately heals us. This is where faith and medicine are not separate. Faith is the foundation. I believe that we were created in the image of a relational God. I believe that true flourishing comes not just from attending to our biology, but living in right relationship with God, with ourselves, and with others. And for me, I cultivate that through spiritual practices like prayer, reading scripture, intentionally spending time in silence, taking Sabbath rest, forgiveness, gratitude, worship. These are not just extras. Over time, they actually shape our nervous system and our stress responses and affect our capacity to experience the peace and healing that's available to us. Of course, faith doesn't mean being passive or ignoring symptoms and just pushing through. We don't want to just tell ourselves, just trust God more. Faith actually means stewardship. It means tending to these bodies that we've been gifted with and participating in God's design for healing by nourishing the body, honoring the need for rest, moving regularly, engaging in meaningful work and loving relationships, and of course, seeking wise counsel when something feels off. If you've been watching my work for any length of time, you probably noticed that I don't fit neatly into any one box. I'm not a typical conventional doctor, and maybe I'm not even a typical conventional or functional medicine doctor for that matter. My deepest calling is to bear witness to the truth that healing comes from God, that it has to be holistic, and that God is present with us in our suffering, and that redemption is not just spiritual, but embodied. And I can't talk about brain health without talking about the God who made our brains. And of course, I do want to say this that for those of you who don't share my Christian worldview, you are welcome here. You don't have to believe what I believe to benefit from the understanding of how your brain works, how lifestyle and biology affect our mental health, how being curious can help replace fear. My hope is to just invite reflection. So, if anxiety, depression, and cognitive changes are showing up together in your life or in the life of someone you love, please don't settle for dismissal. Don't just accept that it's just stress or just aging without a thoughtful evaluation. These symptoms are important signals. They invite exploration and understanding. And when we have that understanding of the root causes, it can open the door to take wise action. If you'd like to learn more about how we approach cognitive decline prevention and treatment and mental health, you can visit us at caringforthebody.org. We offer a complimentary strategy session with one of our patient care coordinators. She can help you discern whether our practice is a good fit for your needs. And if you want to keep going right now, keep learning, I encourage you to watch my last video, Can Cognitive Decline Be Reversed?, where we go even deeper into what's possible when we care for the whole person and we look through a functional medicine lens. Thank you for being here. My prayer is that you leave this video feeling more curious, more hopeful, not just about your brain, but about the possibility of healing in every dimension of your life. Bye for now. Thanks for watching. If you enjoyed this episode of Rethink Aging, please like, subscribe, and share it with someone you love. For more episodes and highlights from the show, you can check out more videos right here and here. I also invite you to join the Rethink Aging community at caringforthebody.org, where you can find more resources on how to better protect your brain, strengthen your body, and live with purpose. Thanks again for tuning in, and I'll catch you in the next episode.